The nation's hospital executives have a clear message for Washington. If the Affordable Care Act is dismantled, we need you to restore the billions of federal dollars hospitals received before the ACA was established. Melanie Evans covers the hospital industry for the Wall Street Journal and joins us now to discuss. Hi, Melanie. Great to see you. Let's back up a little bit just to better understand why hospitals are so worried. What kinds of funds did they receive from the federal government before the ACA?
So prior to the Affordable Care Act, hospitals could qualify for some additional funding if they cared for a disproportionate number of uninsured. And so there was some federal money built into amounts that hospitals got paid that was intended to sort of offset the unpaid bills from the uninsured.
And they will also get annual raises in some cases for taking care of Medicaid patients?
Well, so hospitals get sort of like an annual adjustment. In this case, it's actually under Medicare.
Okay.
And so there's a sort of a formula that they use to kind of adjust the rates that hospitals get paid annually to kind of keep up with the rising costs of caring for patients.
Okay, great. And so then the thinking was, once the ACA was established, look, you're going to have more paying patients, more patients with health insurance. So therefore, we can cut back a little bit on those federal funds.
Yes, yes. So,
and is that what happened in practice?
So yes. So the sort of the Affordable Care Act essentially said, look, the ACA will expand insurance coverage in a couple of ways, using some federal subsidies. So there are the exchanges where individuals with low to moderate incomes can purchase insurance, and based on their income, they can receive some federal assistance. And then there was the expansion of Medicaid, which didn't play out as originally
hoped.
Exactly. So there was a Supreme Court decision that allowed states to basically decide whether or not they would expand Medicaid, and not all states did.
Right.
And there's a very clear difference when you look at hospital financial statements between the states that did expand Medicaid and those that didn't.
Right. Okay, so that comes down to right now hospitals are worried because no one has a clear handle on what's happening with the Affordable Care Act. And is there any, give us an idea of how many hospital associations and executives are now lobbying Congress, and is there any sign that the Republicans are sympathetic?
So I spoke with, for example, the American Hospital Association, which has about 5,000 members. There are hospitals, there are large health systems, there's other organizations, and their head of government relations said, like, they were urging their members to get to Capitol Hill as soon as possible, because
this is an urgent situation for them.
Exactly. Yes. It sort of it was kind of like job number one when Congress sort of kicked into gear. And so
are there signs then that lawmakers are a little sympathetic?
Well, so there was a bill previously passed that President Obama vetoed that did restore some of the funds that hospitals are seeking to sort of reestablish, get restored.
So now that we know, though, that Medicaid or Medicare, I always get them confused. Yeah. Medicaid is on track to be insolvent in 2020.
Oh, so that's Medicare, yes.
Medicare, sorry.
It's easy to get them confused, yeah.
So it sort of raises the question, where would these extra funds come from?
So that was one of the points that I heard as I was reporting the story, which is it is very difficult to ask for money back. And so the raises that we discussed earlier, one of the things that they did is they essentially said, we're going to give you a smaller raise. And that money sort of like is part of what hospitals are asking to be restored. Right. And it would sort of come out of Medicare's budget.
Right. And of course, now there's still a great unknown. We don't know exactly what's happening to the Affordable Care Act. Will it be completely repealed? Will parts of it remain? So where does that all stand right now? Do we even know?
It is very fluid. Yes. It is very fluid. Yes. So when I talked to executives, they were essentially trying to drive home what they felt were their priorities. Yes. No matter what comes out of what's happening in DC right now, no matter what sort of shape this takes, whether it's a full repeal or it's some sort of, you've heard repair, you've heard replace, their sort of primary message is, if we lose those insured individuals, we want this money back.
So the hospitals are making sure no one will forget about them in this formula. Yes. All right, Melanie, thank you so much for that.